this demonstration, we'll be looking at the patient registries. Patient registries are found under the modules in EncounterSuite. And basically, if you think of the guidelines for a patient, all the patient's guidelines, whether it be wellness guidelines or disease management guidelines, if you take all those guidelines for each patient, for every patient in the practice, and aggregate them on the basis of these diseases, 5 diseases, or in wellness, the sum of those lists is the patient registries. We'll be going into the diabetic patient registry, and this is done by a healthcare provider, and you have to have healthcare provider status in order to do this. And it works the same way as disease management and the wellness guidelines. We have not applicable, done already, order now, and future order. And in this case, you can see is that we'd basically, in most cases, you'd simply be ordering the undone tests because they're in yellow. If there's an issue, you can go into the person's chart and try to understand what they have going on in that individual case. And we also have the disease management medication guidelines here, and they work exactly the same way. And if need be, you can go and order a medication for a patient through here as well. We'll go back to the inbox, and so the registry is worked this way, and a physician would go through the practice and all the unmet guidelines he could convert if he wanted to, and put the appropriate orders in. And this is a demonstration. We have most of these things unmet. We'll go back to the inbox, and we have a special category of orders for registry orders, because basically we find that this is something that's going to be done at once, and there could be a whole lot of orders generated. So rather than make it more difficult for a office staff to run through orders in the midst of a busy practice day, this is something that could be done on the out at a different time. And we'll just say needs to be placed, and you see the orders that we just wrote there. I'll just complete 2 of them and show that, in fact, that once that's done, that registry order is met. We'll go back to the registry here, and we'll just refresh it. And you'll see that these guidelines were met. With completed orders. And this one was not met because the order was not complete. Alrighty. The other thing I'd like to show you, we'll go back and we'll just show you the wellness guidelines. And here we have all the guidelines. And again, all these guidelines are based on the MQuick recommendations. And what we'll do is we'll show all the people who need to have a diphtheria vaccination, and we'll view these patients. And this is a list of people now. And again, we have the same thing: not applicable, order now, future order, or done already. But we also have something as well, so we can write, if we go through the list and think everybody needs the vaccine, we can simply just place the order or test for all the patients who have done, and we'll give them all DPTs. And we'll just say OK. And all these people will have the orders done, and we'll go back to the inbox, and we'll see all these people have been ordered for their DPTs. And this is a way to go through the wellness guidelines as well.